If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. Our guest today is Estelle Giraud, who is the co-founder and CEO of Trellis Health. Estelle started out with a career in academia and has a PhD in genetics. She then spent 8 years as a commercial operator at Illumina on a mission to improve human health with the power of genetics, at the forefront of technology and healthcare. She is now building Trellis Health, a consumer digital health company that provides a health data hub and tools to help pregnant women and new families manage their health more effortlessly. She's also a mother and passionate about building an ethical health data system. In this episode, we discuss consumer health data and how having access to your data is an act of health equity. Let's get started. Hi, Estelle. Thanks so much for connecting today.
It's great to be here. It's great to talk with you.
Excellent. So let's just start from the beginning. What got you into healthcare and entrepreneurship?
Yeah, so I have a background in genetics and spent the early part of my career in academia. And I love genetics as a science, as a discipline. I love this idea of kind of really complex patterns and blueprints that manifest in real life. But then I transitioned from that into industry, actually, with a company called Illumina, and it was just perfect timing. For those that aren't familiar, Illumina really has been revolutionizing this entire space of genetics. The technology is just insanely impressive, and access and cost of this as a technology piece is kind of revolutionizing medicine and kind of genetic technologies right now. And so I transitioned to Illumina and was working in Australia and in the US for Illumina as a company, working at the forefront of healthcare and medicine and trying to implicate genetic technologies in medical care. And I realized over the years that it wasn't necessarily the technology piece that was limiting. It was deeper than that. And just at a fundamental layer within our healthcare system, we don't have good data infrastructure. We haven't, and the systems have been built in a very kind of disjointed, build as you go kind of way. But for us to realize truly kind of data driven precision medicine, we need to rebuild that health data stack kind of from the ground up. And I will also say that I feel very strongly about the ethics of this as well. Coming from a genetics background, seeing some of this play out in the industry, if we're going to do this, we need to be able to do it in a really kind of ethical and protective way and really have individuals at the center of their health data. And so that's really what I'm building at Trellis Health now.
Absolutely. That's an amazing story, an amazing background. And I think some of the things you were mentioning around rebuilding the data pipeline probably mostly came from the insurgence of how technology entered healthcare. It was mostly has been mandates around catching up to other industries, mandating going from paper charts to EMRs, right? And not having that forethought, whether it's good or bad, or whether we knew ahead of time or not, of how important it was and how we structured EMRs and how we were collecting data and how then it would in turn affect all of the downstream technology and innovations that will come from it. So that's one thing that I've noticed and thought of when you were just saying a little bit about your background.
Yeah.
So why genetics, and how are you thinking about genetics playing a role in digital health in the future?
Yeah. So I mean, genetics, we're at the earliest stages of this right now, but I believe within the next kind of 5 years, everybody is going to have some kind of genetic testing done on themselves, and in whatever, whether that's clinical or direct to consumer. um, and I don't think people realize how kind of predictive that is as a data form. And that's a good thing. It's not all a bad thing as well. It's not like you have this kind of written in blueprint and then that's it, and there's nothing you can do throughout the rest of your life to kind of change that. It's just that there is a knowledge that, hey, you might be predisposed to these conditions, but if you take these actions throughout your life, you can mitigate that risk, right? So you could, if you do this, we know, you're going to be fine, and live this long and healthy life. And if you don't, your genetics predispose you to this. And um, the other thing that, I mean, going back to what you said before around the health data stack, right? The What we have today is not optimized for AI, machine learning, all of these kind of state of the art computer science tools that we have at our disposal today. And we need those for genetics to really build out those models. And we need to combine that with what's in the EMR and combine it with environmental data and kind of get this holistic picture of health so that we can live healthier lives, and so that we can manage our own health better. But we have to do that, like I say, in a system that respects the individual's rights and privacy and kind of everything that goes in that. But genetics is a really fundamentally critical piece to understanding this.
Absolutely, absolutely. And I myself actually have been debating about getting genetic
Hmm.
testing done and weighing the pros and cons there. So I think you're right on to say that probably in the next 5 years, folks are either going to become more comfortable with getting tested or have gotten tested already, and
Yeah.
navigating that. And to on the flip side of that, I think probably what we'll see too is genetic counseling also becoming an uptick to help folks navigate that, because it is fairly heavy news depending on what you get, and fairly complicated to understand. And there should
Hmm.
be support around that for those who are going through genetic testing in one way or the other.
100% agree.
Well, talk to me about Trellis Health, and why are you starting with maternal health?
Yeah, I mean, I love this question. There is so many reasons, and part of this comes from my own personal experience. Right, I'm a mother. I was had a pregnancy during the pandemic. Went through that. My pregnancy wasn't necessarily, horrific or anything. There was no major health issues, but I still suffered from prenatal hypertension. I had postpartum preeclampsia. These are not really rare occurrences. These affect a lot of pregnancies, and it blew my mind that we don't really know what causes preeclampsia, and this is an enormous problem in our healthcare system. Um, but going back to your question, why maternal health? Why start there? Um, it's this really unique time point in a person's life, typically the first interaction that a young person has with the healthcare system at large. And so you take now a millennial or a Gen Z person that has this extremely digital experience, and you you throw them into these situations where you're having very broad, deep measurements, tons of doctor's appointments, you're taking responsibility for your health like you never have before. And the digital tools and systems there are just like stepping back in time. It's incredibly jarring to have that kind of experience. And you're also reminded on a daily basis. I woke up every morning knowing that I was pregnant. I had the reminders throughout my body that I was pregnant. So you're thinking about healthcare and your own health and the health of your child a lot during that time. It's an incredibly motivated population. One of the issues that we struggle with in healthcare generally is that people are not engaged with their health. They don't feel that sense of ownership over their health, and so they're less likely to take these kinds of actions to build out their own health data hub, or whatever it is. And our software makes that very easy, but pregnancy is this unique time period in a person's life. And so for the child, then in those, the child of those pregnancies, they have the opportunity then to have their health records built from birth. So they're getting this cohesive, all of that health information from the very beginning of their life that can impact them and, impact their healthcare for the rest of their life. And so we have the opportunity to kind of rewrite this from the ground up for the next generation of people. Um, and then something that's just really important to me is this idea of maternal health outcomes and childhood health outcomes. This is in the US today, we have one of the worst, if not the worst, maternal mortality rate in the developed world. And I firmly believe that we can impact some of that positively with just more data around this and giving patients advocacy, so they have the data at their fingertips. They can say, you know what, my blood pressure is increasing. Look at it last week, look at it this week. It is increasing. Can we look at this further, and give the patient that confidence and agency to advocate for their own health outcomes. And then, I mean, another, just I guess lastly, it's a really positive experience, or at least it should be, around pregnancy. A lot of times people have tried to kind of build these health records for cancer patients or rare disease, people that are trying to deal with and navigate very complex negative health situations. Pregnancy is a positive experience. So uh, from a consumer standpoint, it's much easier to build a movement around a positive experience than something negative. And for those, it's not as if nobody is going to have cancer or rare disease or any of these other things, but at least with Trellis Health, our idea is that if we start with maternal health and pregnancy, you're building this hub much earlier. And so if a person gets cancer or something later in life, they have decades of health data to really support them in that care journey, dealing with that illness later.
Wonderful. I think the thing that I haven't heard quite yet is the idea of starting a health record while in the womb.
Yeah.
Having that being essentially, the apex of a very multi-decade record for someone in their health. I find that very compelling. I find it very interesting. I know there's some work that's been done around sort of core blood and that, but I haven't heard anything around starting a health data hub from birth or within the womb. And I think maybe for our listeners, it may be helpful to sort of maybe describe what you mean when you're talking about a health data hub. What is that, and how would someone use it?
Yeah, absolutely. So at Trellis Health, our software is a health data hub for us is your electronic medical record. So these are, when you go to the doctor, if you've been to hospital, kind of anything that's in the medical system is captured in, a MyChart record or a patient portal or your doctor's notes. So all of that together is your electronic medical records. Combined with, in our platform, your genetics. And so this could be through direct to consumer genetic testing like 23andMe or Ancestry or some of the other players in the space, or through clinical genetic testing that's done in pregnancy. So it's becoming standard of care now to have genetic testing done during pregnancy. We want to make sure that we're enabling our customers to pull that data in directly to Trellis Health and kind of have that, that piece of information for themselves and for their child from the pregnancy testing. And then lastly, it's your wearables, Fitbit, Apple Watch, anything that's kind of tracking your day-to-day environmental activities. And so our software, you've not been able to do this in a really frictionless way previously. This is one of the reasons why we're starting this company right now, is there's just a huge number of inflections across regulation, across the way this data is being generated, the systems that we have now, which means that a customer, when they sign up on Trellis Health, we take them through an onboarding. It takes about 5-10 minutes. We can pull all of this information automatically on the back end in minutes. So they don't have to call their doctor. They don't have to, get faxes and get approvals. And it takes days or weeks, and is a very manual process to kind of collect all of this data. We do it via APIs on the back end of our system in a really kind of frictionless way. And so we pull all of that information together, vaccine records, medications, genetics, everything, all into one kind of dashboard. And a patient can navigate that as they wish. But that's really what we think of when we say health data hub. And it's generational, right? It's families. You can swap between yourself or a partner or a child and look at their health data hub as well. And then I will say, we're taking it one step further in pregnancy specifically, and that is, once you have all of this data together in one place, we're building what we call a digital concierge, or these kind of smart digital tools that just help you manage the day-to-day. So if we read from a record that somebody has hypertension and needs to measure their blood pressure, we automatically pre-program reminders. They can input the measurements straight into the reminder. It goes straight to a dashboard. It summarizes that, ready for the next doctor's visit. So it's this kind of, like I say, concierge experience that's done in a very digital way based on a person's data.
That's awesome. So if I was a consumer or user of Trellis Health, I'd be able to go in to your system, have all of my health records, whether it's from my doctor's office or the wearable tools that I'm using, easily, seamlessly uploaded into this hub. I can connect my family members if I so choose, and not only have it as a collection spot, but also as an aid in helping me remember things that are important for my health as I go through future health visits or as I'm tracking it, which is incredibly powerful, especially as we talked about earlier, as folks are moving more towards owning more of their health, having it be more active rather than reactive or passive once something happens, which I am an advocate for. I think folks need to take more ownership of it, and I see folks taking more ownership of it. So companies like Trellis Health that are doing this and aiding folks to get there, I think is a wonderful thing, and it sounds very exciting. You did mention a lot about aspects of this that allow for equitable use of healthcare systems, as well as fighting some of the disadvantages that are currently experienced when it comes to maternal health. I want you to talk a little bit about, how do you see health equity playing a part in what you're building, particularly when it comes to maternal health? As you sort of alluded to, in this country and in countries like the UK and other EU countries, Black women tend to have far worse pregnancy and pregnancy-related outcomes for themselves as well as for their children. So is there something there that you could talk to us about as far as what you're building and how it plays into the health equity landscape?
Yeah. I mean, this is, historically something that just we haven't done a good job at all, really, in healthcare, is making sure that the system does promote health equity in this way. And I think you're right at its core. It's about transparency and ownership and kind of trust in the system as well. But you don't get to trust without that sense of transparency. And at the end of the day, you've got to empower people across the board to feel that sense of ownership and enable them to have that sense of ownership over that. And so for us, it's about a person's data. Like, your data should be under your ownership as much as it kind of can be, or at least you would have transparency and visibility into, okay, this is my data, this is my health data, and know that directly can be used to impact your health. And so, advocacy is a big part of this, right? If you have all of that at your fingertips and are really empowered to be an advocate for your own health, in the example of, say, preeclampsia, throughout our entire health system, you've got real people with real biases there. And as a mother, there's so much in your own health and kind of what happens in that journey through pregnancy, where you rely on your intuition. You know what's going on in your body, and something might be feeling off, or not quite right, or you can feel things changing over the months, or you feel your blood pressure changing. But it's very difficult for a person to go into a 10-minute appointment with a busy physician and really advocate for their health if they're feeling that something is off. And so part of what we're doing is, giving people that data and that agency and that ownership at their fingertips, so they can be better advocates for their health with their physician, and really have that conversation at an equal kind of footing to start with. And then broader than that, like beyond just a person's own health, you want to know that your data is being used at a population level for fair and equitable personalized care for your population as well as other populations. So, in genetic research recently, I mean, as the technology has just kind of exploded, we've done a lot of population genetics studies, and historically those have been done on Caucasian white populations almost exclusively. And you're missing huge parts of health, and what might be relevant for one population is not necessarily the same exact thing for a different population. And so you don't want at one extreme a Henrietta Lacks type of situation where a person's data or biological material is taken without their consent, without their control, without transparency and leverage for medical research. But at the other end of the spectrum, you don't want entire populations to be forgotten and excluded from research so that they don't get the benefit of those new personalized treatments. And so what we're building and really trying to work towards is this idea of health data being critical to this, and really putting the person right back in the center of that, so they can advocate for their own health, but also know that their data is being used in an ethical way to improve the health outcomes of their entire group, their entire population of people.
If I had to summarize that, I would say,
Sorry.
no, this is excellent. This is excellent. I'm going to give you a punchline here. If I had to
Okay.
summarize that, I would say Trellis Health helps folks use data to back up their intuition, to have their providers listen not only to what is verbally said, but what has been documented in a statistical or data way, so that when they're talking about their health and they're advocating for their health, they're able to speak a language that both they themselves can understand and the provider can understand.
Yeah.
Yeah,
And have real data to show, it's not just, oh, I feel off. It's like, no, here is the data.
absolutely. And there's a separate conversation there to be had around having to go to that lengths to be heard in a
Yeah.
setting, but we'll say that for another day. I'm happy you brought up Henrietta Lacks, because I do think when we're talking about sharing your data and using it for yourself and using it with providers, there is a huge component of trust that folks are going to have to get used to, comfortable with, meet head on, ask those hard questions about who they're going to trust with their data, why they are going to trust them with their data, why are they not going to trust them with their data. And that ongoing story and reminder of Henrietta Lacks and others that have been in the healthcare system and may not have had great outcomes, and sharing their data or sharing their bodies for research is top of mind for a lot of folks, and a lot of folks in my community and other communities. And I think there's going to be some reckoning, or there's going to be some dialogue that I hope at Digital Health Review, we're going to help facilitate, but also in the general digital health industry is going to help facilitate with consumers instead of shying away from it, but addressing it head on and saying, we understand that this has happened. We understand that you may have reservations. We want to show you what the impact can be should you choose to go through this transparent process with us and sharing your data, either for yourselves and, as you mentioned, for the general population and what that could look like.
100%. Yeah. I mean, we could talk, I'm sure, for a whole podcast, right? Just on this one topic. It's enormous, but such a critical part of the conversation.
But if someone wanted to get in touch with you, learn a little bit more about Trellis Health, where can they find you?
Yeah, so you can check us out on jointrellishealth.com. We have a waitlist open. We will be launching later this year, live to the public. We have an invite-only beta program, but if you join the waitlist, we will notify people of that beta when that starts in July. And then I'm on social media, on Twitter at Estelle Giraud, and on LinkedIn as well. But I'd love to have people follow along for the journey.
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.